I am Dr. Stephanie Morgan. I am with Limitless Pelvic Health. I've been a pelvic health PT for some time, but also as a personal life, I'm a triathlete. And I've met Felicia Shortino here at a couple swim and bike and some triathlon events here in the local Greenville upstate area. So we've just been able to reconnect in terms of getting to know each other and what you do specifically in the physical therapy world. And just love to kind of shine a light on what you do for the triathlon scene and how we can collaborate as professionals and personally. So just getting to know you. So we have Dr. Felicia Shortino with Endurance Ally that's here in Greenville, South Carolina. And just want to get to know you a little bit more about your physical therapy background to start with. And then we can kind of go into the triathlete side of things.
Yeah, I'm super excited that we're connecting in this way. I mean, you and I have known each other through sport, but it's really cool to finally be connecting on a professional level too. I mean, I know we have this overlap, so this is really fun.
Yeah.
Yeah, so I started my business when I moved here to Greenville about a year ago. This has always been a dream of mine to work with the population of runners and triathletes. Definitely runners. That's always been in the back of my mind since I started PT school. That was part of the motivation for me even being in PT school. I developed a lot of injuries through my experiences in track and cross country in college, which was really like frustrating for me. And I just knew that there was a better way to rehab. So this has always been an interest of mine, but I've kind of evolved into a triathlete over the years. I had a lot of cross training that I had to do when I was injured, and just my time on the bike. I just had to add the swimming, and there I am as a triathlete now. So yeah, this is a new population for me, but I'm really excited to be working with more of the endurance athlete side of stuff.
Yeah. Do you mostly see the triathlete side or do you see each discipline also? Do you see runners and bikers and swimmers individually within their own discipline and then also the triathlete world?
Yeah, so I see a lot of runners. I see some cyclists and then a bunch of triathletes as well. So I haven't really dove into just swimming athletes, but there's a ton of overlap with some of this stuff. I mean, generally speaking, if I see a triathlete, most of the time they'll come to me with shoulder pain from swimming. So that's a pretty common one. So yeah, but a lot of runners and some cyclists as well.
Yeah. What in your clinic and office space do you use in order to better understand the triathlete's injury and how you move forward with treatment of that?
Yeah, so I have a couple of different tools that I use to help evaluate patients. From the running side, I have some tools for gait analysis, which has been super helpful to treating runners and triathletes. It's something that you can't really ignore. And a lot of the times I do see that triathletes get injured from running. That's a pretty common triathlete injury. There's not just as much load or biomechanical strain from swimming and cycling, being that they're not impact sports. So I do see a lot of runners who are triathletes, and that's a common injury. But yeah, I use this equipment called Run Easy. It's a software that I use to help analyze gait. And then working with like swimmers and cyclists, I wouldn't say that I'm an expert in swim form or bike fitting, but there's some things that I do look for in terms of biomechanics for both of those things that I've seen both for myself, that I have personal experience with, and then just doing bike fits and talking with coaches. I kind of know a few things to look for, but if it's really in depth, I try to refer out for those things.
Yeah. Breaking it down to each discipline, what do you think is the most common thing that you see from an injuries perspective in each discipline? So, swimming, what do you feel like your triathletes come to you? What specific injury do they come to you for swimming?
Yeah, I think I touched on this briefly before, but shoulder injuries are so common. And sometimes neck injuries that can mimic shoulder injuries as well. So you kind of have to screen that out and make sure that you're not dealing with a neck injury and overlooking that component to the shoulder. So yeah, those are probably the most common things I see there. And
Biking.
biking, I see a lot of low back pain and hip pain.
Hmm.
And a good majority of that comes down to a good bike fit. but some of it is mobility based.
Hmm.
Like, do you have the mobility in your hips to be able to be in that more aerodynamic position? How much training are you doing on your trainer versus outside? That comfort level kind of stuff is stuff we talk through during treatments. And then for running, I would say the most common one is like IT band syndrome, just because of how tight triathletes get in their hips, and everything being such a linear, like triathlon is very linear. I mean, everything we're doing is going in one direction forward. So we don't use a lot of those lateral hip muscles. So IT band or patellofemoral pain, those are really common for runners.
Yeah. What would you say is the most your most favorite thing to treat? The one that you see like almost short and long term success with.
Um, I see this a lot with runners, so I can't necessarily say it's as common in triathletes, because there's not as much biomechanical stress and load. But with a lot of my runners, I'll see either stress reactions or stress fractures. That was what got me into the field of PT in the first place. So it's something I'm really passionate about, and I get really excited to see the comeback from that. There is a lot of mental stress that comes along with having a stress fracture. So, talking athletes through that, needing to take time off, that's a really hard thing psychologically for runners. And if triathletes happen to get that injury, it can be really psychologically taxing too. The nice thing about triathlon, though, is that we have two other disciplines that we need to be focusing on too. So if you get injured with running or if you have a stress fracture, maybe you're spending more time in the pool or more time on the bike, depending on where the stress fracture is. So that's kind of the cool part of triathlon, is that you don't see a ton of injuries where you have to completely rest, like, or not do anything. So yeah, stress fractures are probably, I can't say my favorite because it's kind of a weird thing to have a favorite injury,
Yeah.
but yeah, I do get a lot of satisfaction out of seeing people come back from those.
Yeah. I think that's the best thing, we can do as, triathletes ourselves is knowing our bodies really well and saying, okay, I've been doing a lot of running. I'm starting to feel this impact, injury. What can I do to supplement that? And I'm going to do a little bit more swim workouts or bike workouts in the meantime, and I can still build my cardio up. And once I get back to the running, the cardio is not a factor. I
Right.
feel like it's really fascinating when people say to me, I want to run, I want to run. I'm like, well, how's your just general cardio? Like, how does your heart rate look under any form of load, whether that's biking or swimming, even going for a long walk? You can't run if you can't walk for a long period of time. So it's really quite fascinating. People do forget like that duration of time that we have to load our cardiac system and feel good about that before we even start to dip our toes into running or even return to running, or whether that's impact or whether that's just going couch to 5K. You'll see a lot of that too. And I feel like um, it's just we try to force it a lot. These higher level athletes that you and I probably work with, we try to force the injury. But sometimes if we're marathon training, we're running a ton. But I'm actually in better shape when I'm triathlon training than when I'm in marathon shape. And I don't know if that's a
So definitely the case for me too.
oh, absolutely. Like, or that's with age too. We find that ourselves are, I need a little bit more cross training than I need just a single discipline kind of exercise. So I encourage a lot of my athletes as a coach and as a physical therapist to dip into other disciplines. It doesn't have to all be about running. Yes, running is something you can do and you can step out your door and just go for a run or a walk. But think about getting onto a bike, and it can be a leisure bike on the Swamp Rabbit Trail, or even with the summer coming up, getting into a pool and doing a few laps. I've had a lot of patients or athletes come to me and say, I can't swim one lap. And I'm like, that could be a problem. And that could actually help us from breathing, or that can help us with cardio. So I encourage people to step into the unknown of the other forms of cross training and getting into cardio. I don't know at your current level in terms of personal training, if that's something that you're currently working towards right now, or what.
Definitely.
Yeah.
I've actually seen like better success for myself with running by doing triathlon training. And you mentioned that earlier for yourself too. My times are faster than they ever were for running. And I think a lot of that comes back to like consistency. I'm able to train more consistently if you're not getting injured. And when I was just running, I was getting injured a lot more. So I'm able to stay consistent with my training more. Of course, I incorporate those rest days or, days where I'm doing some lighter activity. But I think it's really awesome that in the coaching world, there's more emphasis than there ever has been on not just running, which I think is such an awesome evolution of running in general.
Yeah. And you had talked about some stress reactions in the past, and we are starting to hear a lot more on red syndrome and understanding nutrition and sleep and how that goes into stress reactions and overall health, sleep, nutrition, hydration. And the college athlete just doesn't get a whole lot of sleep. We're constantly training. And I feel like we see a lot of those stress reactions, but you've started to see this shift in college training. The higher level athletes who are doing a lot of cross training, who are getting in the pool, either water running or swimming laps, and they're actually running some of the greatest times out there. So I encourage not just the college athletes or coaches, is to start seeking some of these other forms of, cardiovascular endurance to gain some speed or turnover or power. And I know you do a lot with power in terms of strength training, which I would love to dip into and understand more about your philosophies on maybe strength training for the triathlete, and how each discipline would break down. So, what does that look like for your programming?
Yeah, that's a good question. I mean, so much of strength training is about power, like you mentioned, but a lot of it comes down to not fatiguing at the end of races. So for these endurance events that we're doing, like 70.3, Ironman, even Olympic distance, it's a long event. It's like 16 hours,
Right.
depending on how you're doing with a full Ironman. I mean, it's a long time that you're out there, and having that strength training base is so important. So it's a little complicated for triathletes because we've got three sports to be able to balance, and it's a lot of body parts that we've got to make sure are strong. So for swimmers, I try to incorporate some form of rotator cuff strength training, some overhead press stuff so that we can keep our core nice and strong while our arms are elevated overhead. So that's super important for swimmers. Um, for cycling, a lot of like single leg power stuff. So maybe that looks like a rear foot elevated split squat. That's a mouthful,
Yeah.
but just some single leg work so that you're balancing out and finding if you have any of those asymmetries, since running and cycling are single leg activities, technically.
Yeah.
It's really important to find out whether you have a side that needs to be worked on. So incorporating some of that, and then just for basic power output, whether that's running or cycling, doing things like squats or deadlifts. It can only be like once a week. That's all you really need to do for heavy squat or deadlifts. So I try to incorporate that into training as well. It's a little bit easier to make a program for runners versus triathletes because you can be really specific with those muscle groups that are just for running. Gets a little overwhelming sometimes for triathletes. They don't really know where to start. And if they don't have a background in strength training, it's really helpful to have someone kind of help you along with that. So I do work with a lot of those people.
Yeah. I feel like a lot of people go to the gym and they do a lot of squats and deadlifts and double legged activities, but they are missing the puzzle piece. The puzzle piece is the single leg components of everything that is about the sport. Single leg with cycling, single leg impact load with running, and you're doing that thousands of times during races. And so being able to do single leg work is probably the first thing I go to with folks is, what does your single leg balance look like? And can you hop on one foot? Because that is what we do as runners or triathletes and even, swimmers, just trying to make sure that we are loading the system in what the goal is
Yeah.
itself. So I think that is a huge component that a lot of people miss. And triathlon training is exhausting. We both know that. So trying to fit in some form of strengthening is challenging, but trying to reprioritize that, even being once or twice a week, can be helpful. And
Absolutely.
and I know a lot of people will separate time for specific strength training or getting into the weight room. And I'll even say this from a personal perspective. as a mom of two working full time, I haven't been doing a whole lot of strength training. That's probably my biggest missing puzzle piece. But when I am swimming, I am making sure that I am really loading my core appropriately. I think swimming is the best thing that you can do for your core.
Yeah, it's hard.
You really don't, if you are not swimming correctly, you will notice it in your back. You're not tilting appropriately, you're not turning appropriately. But I use that as my core work. I use, biking, I'm really working my core in a good, proper fit, like you had said. And running, I'm making sure I'm in the correct posture. I think runners, you had talked about kind of the multidiscipline piece of it. I think runners who don't bike have the overlap. So I think if you stick a runner on a bike for a long enough time consistently, you're going to start to see this pattern of moving forward and backward and not having so much of this lateral movement. So I would encourage even high school coaches to stick their runners, female runners who are growing, onto a bike and get them actually moving in the correct, alternating pattern. And I think when they come off the bike, that doesn't mean they have to be triathletes, but I think their biomechanics end up being better than they were if that athlete was not riding a bike.
Yeah, and that also comes down to muscle groups
Mm.
that you're working on the bike that you might be neglecting when running. And this is something you hear a lot with runners, you're not using your glutes. Biking is a really good way for you to practice using your glutes and hamstrings.
Mm.
And some of that does come down to, this is getting a little nitty gritty, but
Yeah.
pedal mechanics and
Mhm.
pedal stroke. So you can use just all quads, which I do see a lot with triathletes. It's they're just so quad dominant
Mhm.
because they haven't worked with their running on using their glutes. They haven't worked on their cycling using their glutes, and even swimming. I mean,
Mhm.
you do have to use your glutes and hamstrings. If you're just kicking from your knees and not from your hips, you're
Mhm.
not getting that drive, and you're probably moving around a bit more in the water than you really need to be streamlined. So glutes is a really good yeah, the theme.
Yeah,
We'll
yeah.
call it.
We're seeing it all along the board with all the disciplines for sure. Um, so we talked about females in the sport. And I obviously have a huge passion for the postpartum athlete, getting back into things. But females in the sport, we had talked about Rett syndrome. You should probably start seeing that kind of stuff in the high school athlete once they are starting, going through puberty and menstrual cycles. And you see that wax and wane within their cycle. And iron deficiencies in high school is obviously a big thing, and they're starting to understand hormonal components. You see that into college as they become maybe a more recreational runner, or if they seek the other level, um, running in college or swimming in college, but also trying to balance the sleep component, the nutrition component that they've never really had to think about. And then into this level of post collegiate swimming or biking or just running for recreation. The postpartum athlete, I think, deals with a lot of sleep deprivation and this psychological mental component of comparing themselves to who they used to be. But I feel like we have to give ourselves grace in that process of the female athlete in terms of how our hormones change within all that. Um, what are your, I guess, biggest perspective on the female athlete, endurance athlete? It doesn't have to be the triathlon. It could be the runner. It could be the long-term cyclist. But I would love to hear your insight on the female athlete and moving forward, in this community. The Greenville area is such a high cycling community, running community. We've got some really good female triathletes in this area. So it's been kind of fun to all collaborate with each other. But what are your thoughts and insights on the female athlete in this endurance world?
Goodness, I feel like we could do an entire podcast episode just on this topic.
Yeah.
It's something I get so excited about and passionate about. I just finished reading or rereading actually Lauren Fleshman's book, Good for a Girl. If you haven't read that book and you're a female athlete, I highly recommend that you give this book a read.
Yeah.
But this goes back to everything that prompted me to start my practice, everything I experienced as a college athlete myself, going through injuries. I see this so often with female runners, just getting into the psychological turmoil that comes with injury, it can be really, it can challenge your self-worth, and self-identity. You can kind of question like who you are once your sport is taken away. So there's so much that goes into it, that I try not to get too outside of my like scope of practice, but it is something that we really need to identify as PTs. So that's a topic that I'm really excited about, and I think we're still just on the precipice of learning about all the ways hormones affect performance and the trying to think of the word.
Just the ebb and flow
Yeah,
of the hormones.
yeah, kind of the cycle of like when you're going from being a high school athlete into college, and there's a natural dip in performance, which is something that Lauren Fleshman touches on in her book, and that being a normal process. And then in this age that we're in, like we're kind of in our prime for endurance sports, and that's really exciting. And you mentioned that our area is like has so many awesome female endurance athletes, which is so cool because we all get to push each other, but also encourage each other. That's something I found with this Greenville area that I didn't necessarily experience in college. It's just the supportive nature of everyone around here, and like women supporting women. It's awesome, and I love that that's where the sport is here in Greenville.
Yeah. Yeah. I can pull you over to the women's health side of things. I'm ready if you want to dip into the dark side.
I am ready.
Yeah. It's really a cool missing puzzle piece. And, as an orthopedic therapist for a long time, I never dipped into the women's health, pelvic health side of things. But once you kind of start to go through that phase of your life, you're like, wow, like there's a lot to this that regular orthopedics don't ever see. So I highly encourage all physical therapists to not push aside the pelvic health side of things, or even the mental load or the psychological components that you had talked about earlier when it comes to the ebb and flow of hormones. And coaches who, I think good coaches, running coaches, endurance coaches who are good will be able to push the high school female athlete enough, but not too much to have a psychological barrier. You see these really good 7th and 8th graders out there hit puberty at 9th grade, and they're going to, and it's normal. But what can we do during that time to keep their mind aligned, and still physically able, but not put those expectations and push them through that? If you can see that athlete through the other side of that dip, once their hormones start to regulate, you're going to have a really good athlete when they're a junior and senior. But if you push them too hard, you're going to see a kickback on that, in a negative way, that they
Yeah.
may leave the sport for some time, or they might just have constant injuries that we're not thinking of sleep or nutrition or hydration. And again, they're 9th grade girls.
Yeah,
And
or even like girls who hit puberty a little bit later, and that starts to happen in college after they've gone through the recruiting process.
Mhm.
Like that can be really psychologically taxing, especially if a coach is so focused on weight, which is something that I experienced in college, which was really detrimental to my performance, both from a mental and physical perspective. Like if we can get away from that focus on weight entirely, and I feel like this is less of the case with triathlon and definitely more the case with running. But you see it a little bit with triathletes as well, just a focus on like being lighter and that being helpful for performance. Like I think we just need to get away from that mindset.
yeah,
But yeah, for coaches to be educated on the fact that like yes, there is going to be a normal shift in weight once athletes start hitting puberty, and that's not something that we should associate with being like shamed. I think that is going to be a really crucial shift in mindset.
yeah. It's not just coaches, it's parents' expectations as well.
True. Yeah.
Us as physical therapists have that understanding. Coaches, to a degree, who are educated in that, but also managing the parents' expectations during that time frame to tell them what to expect and that it's okay.
Yeah.
But I think you talked about some of the higher level elite female athletes right now are a little bit older. They have more life experience. They're also focusing on strength training, and they're showing it in the social media world that they do strength train in different ways. And it's not always heavy, but it's maybe just really specific. and they're showing how they do that. Ali Ostrander is a big one who's kind of
Love
dipped
her.
into, she's awesome. I raced against her in college, so it's pretty cool to kind of see her on the comeback and actually like redefining herself a little bit, which
Yeah.
is so cool. But then you've got a ton of postpartum athletes who are very high level, having babies and coming back to the higher levels. I think us as moms, maybe it's a hormonal thing and we need to do a little bit of research on understanding progesterone, estrogen, and testosterone postpartum at the higher level athletes. Kara Goucher being one of those folks, we see a lot of these people who are having pregnancies and deliveries come back even better than they used to be. Ellie St. Pierre on the track.
Oh my
And
gosh, she crushed it.
right, she's amazing. And so she's currently pregnant right now with her second. And she's doing well even at a shorter distance, right? You see a lot of these folks who will trend more up to the marathon as they get older, which is great. It's changing in muscle dynamics and, what muscles are made of and fast and slow twitch muscle fibers or what they strength train in. But I would love to see some more research in understanding the postpartum elite athletes and what
Yeah.
their structure is different and why does it make them better? Is it a
Yeah.
psychological component?
I'm sure in part. I feel like it's so easy to look at those athletes and then think like that's what I should be doing. Um, so there's a balancing act that we have to reach and feel like, okay, just because I'm not doing that doesn't mean that what I'm doing is bad. And like everyone's timeline's going to look a little different. I haven't had kids yet, so I have not experienced what this full ebb and flow might look like for me and for everyone. I'm sure it's different, but it's really encouraging to know that if that's your goal, that's what you really want to be doing, and like things in life are working out where you can get back to that high level. It's so nice to have role models to be able to look up to and be like, yeah, I can do this again.
Yeah. We're not going to the Olympics, obviously, but we can still have our own individual goals, like being able to finish 70.3 or, having higher level goals of doing a sprint triathlon or the world championships. But everybody's short and long term goals are different. And that is going to change in your phase of life. And I think reevaluating that and making things very realistic. And knowing that there are people out there who do that we can cheer on and they can cheer us on too.
Yeah.
So it's cool. You talked about the collaboration of this area and trying to connect with different people in this area and encouraging each other. You're right. That was not in the high school level. That was not in the college level. It was always a battle
Yeah.
between your competitors. And now maybe as we age or maybe we look back on that and it's just different now. So
Yeah.
I hope that is a culture change that we
Yeah.
can all be encouraging for each other in the sport.
I do wonder how much of that comes down to just like experience and maturity and not feeling like, okay, just because that person's doing well, that doesn't have to reflect poorly on me. Like you can have your own separate goals and your own separate timeline for things and not have it affect your performance. I'm really happy that the girls around here have that kind of mentality because it makes the sport so much more enjoyable.
Absolutely. What is one piece of advice you would give to any athlete, I guess, that is sidelined by some type of injury?
Um, I see a lot of people start to give up hope when they've had an injury that lasts for a long time. So find some people around you who have gone through what you've gone through, almost like a support group. And that can be your physical therapist, that could be other athletes that you train with. Start talking about it. Like talking about it and being vulnerable gives it less power over you. So, yeah, I just encourage you to find those people who you can find with your support system and then know that you have hope for getting back to what you want to get back to if that's what you want to do again.
Yeah, I love that. So wrapping up, I guess, how can people get in touch with you as a physical therapist or even personally from a triathlete world too?
So my Instagram is a great way to find out more about what I do. I post a lot about running injury prevention, a little bit about triathlon injury prevention, or rehab sometimes. So yeah, my Instagram is Endurance Ally PT with the underscores in between. And then yeah, my phone number is on there. My email is on there. My website is a great place to learn more about what I do. And then I offer free consultations. So if you're interested in learning more about what I do and how I might be able to help, you're welcome to set up a free consult.
Yeah. Where are you located?
I'm in downtown Greenville, so my office is inside a gym there. So Anytime Fitness on Washington Street.
Okay, awesome,
Yeah.
awesome. Well, we have Dr. Felicia Shortino here with Endurance Ally. She's a physical therapist who specializes in orthopedic clinical specialist with Endurance Ally. Check her out in terms of any of the three disciplines: swimming, biking, running, or a triathlete world, endurance athlete. I've loved having you come on and talk just openly about the physical therapy field, and then the endurance athlete, the female athlete. We got to touch on a lot of different things, so we'll definitely keep
Thanks
up
so
this
much for having
collaboration.
me,
Yeah,
and I'm glad I got to learn from you too about more of the pelvic health side of stuff.
yeah, we can always learn.
Yeah, I definitely want to pick your brain more.
Love it. Let's go. All right, thanks so much.